Hi, I'm Molly Sullivan with Golfers MD, your source for all your golf health, fitness, and injury information. Golfers are prone to hamstring injuries, which range from minor strains to total rupture of the muscle. They're caused by excessive stretching or tearing of muscle fibers and soft tissues. The pain and injury can often cause golfers limited mobility and misplay. Today we visit with Dr. Rhonda Boschron, sports medicine orthopedic surgeon and athletic trainer, to tell us more about hamstring injuries.
An athlete typically will get a hamstring injury after doing a running or loading activity that causes extensive force at the hamstring muscle group. Typically, it is not caused by a blunt force to the actual muscle belly. However, it will occur from extensive loading to that muscle group. Symptoms can be as minor as irritation at the back of the leg to as extensive as a rupture where there is bruising, pain, and debilitating discomfort where the athlete cannot walk. Minor symptoms will be in the form of pain and inflammation. Usually there is difficulty in squatting or sitting positions with a hamstring injury. Treatment usually involves modalities to help the spasticity of the muscle, the inflammation of the muscle, and help to repair the muscle group or the tendinous insertion point. Also, treatment will involve rehabilitation as well as short periods of rest if needed. An athlete can usually return to play with a hamstring injury if it's minor. However, the majority of these tend to be quite extensive and does not allow the athlete to return to play because they are unable to run and or jump with the same force or intensity as prior to their injury.
Those are probably the most common muscle strain that I see, and just pain, unable to run. I actually have a really good experience with a lady who was in the United States rugby team, on the rugby team, and for 2 years she suffered with hamstring pain, strain, couldn't run, couldn't walk, and she came to me. It took me exactly 8 weeks to get her back on the field 100%. I did not touch her hamstrings. One of the traditional methods of treating hamstring strains is using ultrasound, electric stim, stretching the muscle. And recently a paper came out, it was a case study that compared that traditional approach to treating hamstring strains as opposed to this non-traditional approach, which is I use. There's a lot of neuromuscular training, improving your balance, strengthening the hip and trunk core. And that's what I did on this lady, and she had great results. So it really depends on the therapist that you go to, what method they're using, but it could take up to 8 weeks to recover from hamstring problems.
Be sure to keep these tips in mind when you prepare for sports and want to stay strong and healthy. I'm Molly Sullivan with GolfersMD.com. Remember, at GolfersMD, health equals performance.